Hi, I'm Adam Gunton, founder and managing partner of Behavioral Health Partners. And today, I'm going to guide you through the entire process of how to open a drug rehab center. Whether you're a healthcare professional, real estate investor, or entrepreneur, starting a rehab facility is a complex journey that requires careful planning, regulatory compliance, and a strong and strategic approach. In this video, I'll walk you through each critical step from the feasibility study to licensing, staffing, and marketing. By the end, you'll have a clear roadmap to launching a successful addiction treatment center. The first step in opening a rehab center is conducting a feasibility study. This is a comprehensive analysis to determine whether your planned center is viable for a successful business that fills a need in a specific area and is a financially feasible business. The study will evaluate factors like market demand, location, competition, and potential profitability. You'll need to assess if there's a real need for an addiction treatment facility in that area and how you can differentiate your services from competitors. A solid feasibility study will provide the foundation for your entire project and give you the confidence to move forward or refine your business model. It should include the entire process you need to take to get licensing and accreditation, all the competition around you, reimbursement rate ranges, and if you already have a property, if that property is zoned correctly or what would need to happen to get it zoned right. The document ends up being between 70 and 120 pages, so it is a lot of work, but it is important to understand the project you are getting into. It will also include an estimate of the total investment needed to open and the consultant's opinion of yes or no for it being feasible. A feasibility study done by a consultant can be anywhere between $5,000 and $20,000. If you have not conducted a study like this, I highly recommend utilizing a professional in this space that understands what needs to be known to make sure your dream can become a reality. You can check our availability for a study by filling out your information on this page to set up an appointment for a call. Once you've confirmed your center is viable, the next step is creating a pro forma, a financial projection that outlines your expected revenue, expenses, and profit margins. This financial plan is crucial for securing funding from investors or lenders, as it shows them your center's potential for profitability. Your pro forma should cover the cost of facility acquisition, renovation, staffing, equipment, and marketing, as well as projected income from client admissions. You'll also want to calculate your break-even point, what month you have paid investors back and become profitable, and the real potential ROI. We are lucky at Behavioral Health Partners to have David Purinton as our financial partner, who has taken a treatment center from bankruptcy to a $9 million exit in 19 months with his financial strategies. A pro forma from consultants in this industry run anywhere between $2,500 to $7,500, and ours are right in the middle of that. But I have never seen a pro forma that can be followed as financial plan with honest and real margins like the ones we are able to create with David. This leads us into the business plan, which goes beyond the numbers. Your business plan should clearly state your mission, services, and operational strategy. It should outline the types of treatment programs you'll offer, whether that's detox, residential, or outpatient care, and define your target demographic. A well-structured business plan will guide you through the rest of the startup process and serve as a roadmap for growing your treatment center. Business plans run roughly the same cost as a pro forma, and these are something you want someone to do that has opened centers that have become a successful business, but have also been part of centers that had major hiccups in the process, so they know what to look out for. And again, we have an incredible team here who have opened, scaled, and sold multiple centers around the country. Now that your financials and business plan are in place, it's time to tackle state licensing. This is a critical and oftentimes consuming process, as each state has its own specific regulations for opening a drug rehab center. You'll need to apply for a state rehab facility license, which involves submitting detailed documentation of your business plan, facility layout, policies and procedures, and staff qualifications. Your facility will undergo inspections to ensure compliance with building codes, health standards, and patient safety protocols. Some states are a piece of cake that we can do while we sleep in like 3 to 6 months. Some states like New Jersey and New York will take a minimum of 18 months due to long lines and stricter regulations for licensing. I don't say that to deter you, but to prepare you, and ask that if you speak with a consultant who says they can do it in less time than that in those states, it's just not true. We know the people in charge over there, and there is no cutting the line for anyone. It is what it is. It's important to do thorough research on your state-specific requirements and timelines, as missing even one component can delay your opening by months. If you did a proper feasibility study, this will be included with an estimated timeline for licensure, as well as the entire requirements laid out on a platter for you. An often overlooked but essential step is choosing the right electronic medical record system, or EMR. Your EMR will be the backbone of your center's day-to-day operations, helping you manage patient records, billing, and compliance with healthcare regulations. Look for an EMR system designed specifically for addiction treatment centers, as these platforms are tailored to the needs of behavioral health and include features like group therapy scheduling, detox tracking, and reporting for insurance claims. A good EMR system ensures seamless communication between staff and supports your center's ability to provide high-quality care. If you are a medical professional using an EMR now that you know and like, check with an addiction treatment professional to see if it would be a good one for transferring to these services. I may know a guy. Next up is hiring the right staff. The success of your rehab center will largely depend on the quality of the team you build. You'll need a combination of clinical and administrative professionals, including licensed therapists, medical staff, case managers, and support staff. It's crucial to hire individuals who not only have the necessary qualifications, but also have a passion for helping people find recovery. To ensure your center operates smoothly, consider hiring a clinical director to oversee treatment programs and a program or operations director to manage day-to-day and regulatory requirements. You'll also want to invest in training your staff on best practices for addiction treatment, patient care, and confidentiality. Hiring the right people early on will help establish a positive culture of care and professionalism, setting your center apart in terms of quality and outcomes. Behavioral Health Partners is partnered with incredible staff recruiters, in this space specifically, that we introduce to our clients when they need to find the right staff. We also have Dr. David M. Berry to help as a fractional medical director for treatment centers, providing high levels of medical inpatient treatment. Now let's talk about accreditation. Accreditation is crucial for demonstrating your commitment to high quality care and patient safety. You have two primary options, the Joint Commission and CARF. While both are respected, I highly recommend pursuing the Joint Commission accreditation for addiction treatment centers. TJC's rigorous standards for patient safety, care quality, and staff training are widely recognized by insurance providers and referral sources. Having TJC accreditation will not only enhance your center's credibility, but also make it easier to secure contracts with insurance companies, which is key to long-term financial stability. The accreditation process requires your center to meet specific operational and clinical standards, so it's important to start preparing early. This includes developing detailed policies and procedures, training staff, and ensuring your facility meets TJC's safety requirements. We help our clients with the preparation of these requirements, do mock interviews of staff to ensure training and understanding is up to TJC or CARF standards, and help with the facility layout and preparation for the visit. Finally, let's discuss your strategic marketing plan. I don't know if you can tell by this video and the place you're seeing this video, but this is my area of expertise, and I absolutely love the work we do here at Behavioral Health Partners, connecting the right patients to the right centers at the right time that saves lives. I'm also lucky and blessed to be in this space, and when you are opening your center, you'll understand exactly what I mean. However, even with the best treatment programs and staff, your center will not thrive and oftentimes will fail without an effective marketing strategy. Addiction treatment is a very competitive field, so your marketing must be targeted and data-driven to reach the right audience, those actively seeking help. Your marketing plan should include search engine optimization or SEO to make sure your center ranks high in Google searches for terms like rehab near me or addiction treatment center. 61% of people looking for treatment, whether the person in need of help or their loved ones, go to Google first. It is essential you work with experts in this field who can help you do that. You'll also need to invest in paid advertising on platforms like PPC Google Ads and Facebook to reach people in your area who are looking for addiction treatment options. In addition to digital marketing, consider building relationships with local referral sources such as hospitals, doctors, and community organizations. These partnerships can help drive admissions and establish your center as a trusted resource for addiction treatment in your area. A strong business development role at your center will help you do this. However, your website is still your most important marketing tool, so make sure it's optimized for conversions and offers clear information about your services. It should communicate effectively exactly what your program is, so what people see on the internet is what they get when they come to your center. A professional, user-friendly website can be the difference between someone choosing your center or a competitor's. Opening a drug rehab center is a rewarding yet challenging journey. From conducting a feasibility study to hiring the right staff, securing accreditation, and developing a marketing plan, each step is critical to your center's success. By following this roadmap, you'll be well prepared to launch a treatment center that not only helps people recover, but also thrives as a business. At Behavioral Health Partners, We specialize in guiding new treatment centers through every stage of this process, from feasibility studies to marketing strategies. If you're ready to make a lasting impact and open your own drug rehab center, fill out the form on this page and schedule a call with myself or another person here at Behavioral Health Partners, your partners in growth and impact.